Well, this is a really important topic. So my family and I, we were early adopters of COVID. We were infected in March of 2020 after an event with our church, and we all had COVID very early in the process. And it's not something that I would ever want to repeat after 16 days of fever and a viral pneumonia. We all handled it kind of differently in our family. My college-age daughter handled it pretty easily. My wife had a flu-like illness for a week, and I was sickest for the longest. Our other two kids did extremely well. What's interesting is that I work in a research laboratory and may or may not have had the ability to measure blood and look at the levels of antibodies that were created right after the infection. Depending on how sick we were in our family, we had higher or lower levels of antibodies. I had the best. I'm not bragging, but I had a lot of antibodies and they were really good. I still got vaccinated because over time, even my really good antibodies started to fall. And I knew I was going to be exposed through work, and I knew that there would continue to be transmission in the community. Here's what I think we have to appreciate. When you have wild type infection, you do develop an immune response. But the milder the illness, the less robust that immune response is. Does it mean nothing? Of course not. It means something. It's just not going to necessarily prevent all infections. Will it prevent severe infections? Often it will, but it doesn't do it routinely and as perfectly as we'd like it to. So for those who are at high risk, maybe because of obesity or heart disease, lung disease, those that are elderly, I don't think we can rely just on that wild type immunity that comes from being infected. I think the combination of infection plus vaccine, that's a powerhouse combination. And it's one that I'm certainly relying on as I go see patients and as I interact in our church or in our community, trying to make sure that not only am I not becoming infected, but more importantly, that I'm not spreading it, right? We're at a point in the pandemic now where enough of us are vaccinated that by and large, I'm going to be protected against severe disease. But I have far too many friends who are either immunocompromised or unvaccinated for some reason. I really want to protect them as well.